First of all, to do what we do at the level we do it, you need to not just be trained, but you need to be board certified in cardiac thoracic surgery is how it's referred to. So we're certainly that. The single greatest qualification that I have as a specific individual is that, for better or worse, for just how things turned out, I've done more surgery on more patients that involve the aorta than pretty much anybody who's ever lived. From a historical standpoint, I think it's important. A lot of aortic surgery, as we've known it and know it today, many of the techniques and surgeries that are directed at the aorta were developed and came out of these institutions. And we were among the first to focus on these aortic problems and have continued to have a very successful and busy surgical program specifically designed to manage problems of the aorta, whether it be the proximal aorta in the chest all the way to where the aorta bifurcates and spreads out to go to provide the blood supply for the legs, for the aorta from the aortic valve to the bifurcation.